All right, so are you ready for a deep dive today?
Always.
Awesome, because we're going on a medical mystery tour today.
Ooh, I like that.
We're talking about those tiny but powerful parathyroid glands
Ah, yes.
and how doctors actually pinpoint the source of trouble before surgery
Okay.
for primary hyperparathyroidism.
Right.
You're probably thinking, like, how do they even find those things?
Yeah, they are so small.
They're so small. Well, that's what we're here to unpack today.
Sounds good.
We've got this fascinating medical document
Huh?
all about preoperative localization for parathyroid surgery.
Oh, cool.
And trust me, the methods they use are surprisingly clever. Think like heart imaging tech.
Really?
That accidentally turned into a parathyroid superstar. Curious.
Yeah, definitely.
Let's go.
It's pretty amazing how these techniques evolved. I mean, imaging is all about guiding the surgeon's hand, right?
Right.
Making surgery as precise and minimally invasive as possible.
Right, less poking around means you're back on your feet quicker.
It's exact.
So before we get to the really high-tech stuff,
Yeah.
let's just quickly define primary hyperparathyroidism.
Okay, sure. So it's basically a condition where one or more of your parathyroid glands,
The tiny glands in your neck.
right, those tiny glands in your neck, decide to overproduce parathyroid hormone.
Okay.
And this hormone's job is to regulate calcium levels in your blood.
Right?
But when there's too much of it,
Yeah.
things can go haywire.
Okay, so imaging helps to kind of locate the source of this hormone overload,
Yeah.
but it's not about, like, diagnosing the condition. Right.
Exactly. Imaging comes in after the decision to operate has already been made,
Okay,
based on blood tests and stuff.
gotcha.
And in about 80 to 85% of cases, the troublemaker is a solitary benign tumor
Okay.
called an adenoma.
So how do they even find these tiny adenomas hiding in the neck? I mean, we're not talking about, like, grapefruit size here.
Right.
This is tiny.
That's where imaging technology comes in. And one technique that revolutionized the field is called sestamibi scintigraphy.
Okay.
And you won't believe how it was discovered.
Give me the backstory. I love a good medical origin story.
So back in the 1980s, doctors were using this radioactive tracer
Okay.
called technetium 99-meter sestamibi,
Catchy.
or 99-meter TC sestamibi for short,
Okay.
to image the heart. It was
Right.
like a standard procedure. But then they started noticing something interesting.
Yeah.
This tracer was also accumulating in parathyroid adenomas.
Oh, wow.
Talk about a happy accident, right?
Wow, so a heart imaging technique stumbled upon a new superpower.
Exactly.
How does it actually work for parathyroid glands?
Well, the radio tracer gets taken up by both the thyroid and parathyroid glands,
Right.
but it tends to stick around longer in the parathyroids.
Okay.
This difference in retention allows doctors to distinguish the parathyroids from the surrounding thyroid tissue
Okay.
on the images.
So it kind of highlights the parathyroid like a spotlight on stage.
Yeah, kinda.
That makes sense.
Yeah,
But I'm guessing it's not always that straightforward.
you're right. While helpful, sestamibi scintigraphy alone isn't always perfect, especially if you have multiple adenomas
Right.
or thyroid disease, which can kind of muddy the imaging waters.
So what happens when these adenomas are trying to play hide and seek? Do they bring out the big guns?
That's where SPECT comes in.
Is that a top secret spy agency or something?
Not quite, though it does sound like something out of a spy movie.
It does.
It stands for Single Photon Emission Computed Tomography.
Okay.
Basically, it takes sestamibi to the next level
Okay.
by creating 3D images.
Oh, cool.
It's like giving the doctor X-ray vision, right?
Right.
Allowing them to see exactly where those adenomas are hiding,
Okay.
even if they're tucked away behind other structures.
Okay, that makes sense. 3D imaging would definitely make a difference in pinpointing those tiny glands. But is SPECT always a slam dunk?
Unfortunately, no. Even with SPECT, there's still a chance of missing multi-gland disease, meaning more than one adenoma. So surgeons often use additional techniques to make sure they've found all the culprits.
Makes sense. You wouldn't want to leave any of those troublemakers behind. So what other tricks do they have up their sleeves when it comes to imaging?
Well, one technique that boosts accuracy involves using two different radio tracers.
Okay.
So imagine you're trying to edit a photo to focus on a specific object.
Right.
You might use a filter to remove the background.
Right.
It's kind of similar here. One tracer targets both the thyroid and parathyroids,
Okay.
while the other is specific to the thyroid.
Right.
By subtracting the images, they can isolate the parathyroids more clearly, making those adenomas stand out.
That's a clever technique, kind of like a photographic magic trick. So we've covered the high-tech nuclear imaging. What about something a little more familiar, like ultrasound?
Oh, yeah, ultrasound definitely plays a crucial role. It's a common non-invasive technique
Right.
that's, readily available, relatively inexpensive, and doesn't involve any radiation.
That's reassuring to hear.
Yeah.
So what are they looking for when they use ultrasound to find those adenomas?
So parathyroid adenomas actually have a distinctive appearance on ultrasound.
Okay.
They typically appear as a smooth, dark mass,
Okay.
often with a single blood vessel feeding them.
Okay.
This makes them stand out from the surrounding tissue, making them easier to spot.
So ultrasound is like the detective's magnifying glass,
Mm-hmm.
helping them zero in on those adenomas. But I'm guessing there's a catch, right?
You're right. Nothing's ever that simple.
Right.
Ultrasound is highly operator dependent,
Okay.
meaning the experience and skill of the technician.
Right.
Performing the scan can significantly impact the results.
Okay.
You want someone who knows what they're looking for.
Right.
In fact, there was this one case where a patient had undergone multiple scans,
Oh, wow.
and the adenoma was missed each time. Then an experienced sonographer took a look, and boom, they found it right away.
Wow.
Tucked away in a tricky spot.
Wow, that really highlights the importance of expertise in medical imaging, right?
Yeah,
It's not just about the technology, it's about the human element behind it.
exactly.
Now, do doctors ever combine these imaging techniques like ultrasound and sestamibi?
Absolutely. Combining sestamibi scintigraphy with ultrasound is like bringing in the dynamic duo.
Okay.
They work together beautifully, and studies show this combo yields the highest accuracy, somewhere between 79 and 95%, in pinpointing single adenomas.
Wow, that's impressive. Sounds like a real power couple in the world of parathyroid imaging. But even with this dynamic duo, I imagine there are still some challenges.
You're absolutely right. Even this powerful combo can't always predict multi-gland disease.
Right.
That's why thorough surgical exploration is still crucial to ensure they find and treat all the affected glands.
So even with all this technology, surgeons still need to be prepared for the unexpected. Now, what happens when things get really complicated, like in cases where someone has already had surgery in that area?
That's when 4D CT comes into play.
4D CT. Now we're talking serious technology. Tell me more.
Imagine a high-definition movie of your neck,
Okay.
but instead of just showing the anatomy, it also reveals blood flow in real time.
Oh, wow.
That's what 4D computed tomography does.
Okay.
It uses a contrast dye that allows doctors to see how blood moves through the parathyroid glands,
Okay.
making it easier to identify adenomas that might be obscured by scar tissue
Right.
or anatomical changes from previous surgeries.
So it's like having a rope map that shows you the exact location of those tricky adenomas, even if they're hidden in the surgical maze. Pretty impressive.
It is, and it's especially useful in reoperative cases where the stakes are higher due to the increased risk of complications.
Speaking of reoperation, why is it considered more challenging?
Think of it this way. You're a surgeon trying to navigate through a dense forest that's been overgrown with thorns and tangled vines.
Okay.
That's what it's like trying to reoperate on the parathyroid glands.
Right.
Scar tissue from previous surgeries can distort the anatomy, making it difficult to identify the glands,
Right.
and increasing the risk of damaging delicate structures,
Oh, wow.
like the recurrent laryngeal nerve, which controls your vocal cords.
Right.
Yeah.
That sounds incredibly delicate and complex. I can see why precise localization is crucial in these cases.
Absolutely. Before going back in, the standard practice is to have 2 concordant imaging studies,
Wow.
like sestamibi and ultrasound, both pointing to the same location.
Okay.
It's like double-checking your map before venturing into uncharted territory.
Makes perfect sense. 2 confirmations are better than 1, especially when dealing with such delicate structures. But what if the imaging is still inconclusive even after all that? Are there other options?
In those tricky situations, doctors might consider additional imaging studies,
Right.
like MRI,
Right.
or even invasive procedures like selective venous sampling, where they take blood samples from specific veins to measure parathyroid hormone levels.
Okay.
Yeah.
So they're really pulling out all the stops to get a clear picture before heading back into surgery.
Mm-hmm.
What about cases where they suspect multiple adenomas? Is the approach different?
If imaging suggests multiple adenomas, or if it's just inconclusive, The safest approach is often a bilateral neck exploration.
Meaning they look at both sides of the neck.
Exactly. It's a more extensive surgery, but in experienced hands, it has a high success rate and a low risk of complications.
So they're kind of casting a wider net to make sure they catch all the rogue adenomas.
Right.
Well, I'm feeling much more informed about this whole world of parathyroid imaging. I had no idea it was so complex.
It's fascinating, isn't it?
It is. It is. And there's always more to learn.
Always.
Speaking of learning, I hear you have a final thought-provoking tidbit for us before we move on.
I do. It has to do with the language surgeons use to communicate with each other
Okay.
about these tiny glands. They have a system called standardized nomenclature for describing the location of parathyroid adenomas.
Okay.
It uses letters A through G.
Letters A through G.
Uh-huh.
Like a secret code.
Kind of like that.
Okay.
To pinpoint the adenoma's position relative to surrounding structures,
Okay.
the system allows them to, communicate with laser precision
Right.
about the adenoma's location, which helps them plan their surgical approach
Right.
and anticipate potential challenges.
Okay.
It's a fascinating glimpse into the world of surgical communication and anatomical detail.
Wow, who knew there was so much detail involved in locating these tiny glands? I'm definitely going to have to look into this standardized nomenclature system.
It's really quite remarkable, and it reflects a deeper understanding of the embryological development
Okay.
and anatomical variations of these glands.
Okay, now you've really piqued my curiosity. Tell me more about this embryological connection.
Okay, so picture this. Way back in the womb, the parathyroid glands start their journey as tiny buds of tissue.
Okay.
As we develop, these buds migrate down the neck,
Okay.
eventually settling into their usual positions,
Okay.
near the thyroid glands.
So far, so good. But what happens when these little glands decide to go off the beaten path?
That's where things get really interesting.
Mm-hmm.
Sometimes those wanderlust glands take a detour,
Okay.
ending up in unusual locations.
Okay.
Imagine packing a suitcase and some items end up in the wrong compartment.
Right.
It's kind of like that.
So instead of settling near the thyroid, they end up somewhere else entirely.
Exactly. They might end up behind the esophagus, down near the thymus gland in the chest, or even nestled within the thyroid itself.
Wow, that makes surgery a lot more challenging. Surgeons really need to be prepared for anything.
Absolutely. That's why thorough preoperative imaging and a solid understanding of parathyroid anatomy are so crucial.
Right.
It's like a detective story, piecing together clues to find those missing glands.
It's amazing how much goes into planning for what seems like a straightforward surgery. You don't always think about all the behind-the-scenes work.
It's a testament to the skill and dedication of these surgeons. I mean, they're dealing with incredibly delicate structures in a very confined space. And remember, they're aiming for a minimally invasive approach whenever possible.
It really highlights the artistry of surgery, doesn't it? It's not just about cutting and stitching. It's about precision, knowledge, and a deep respect for the human body.
Couldn't have said it better myself.
Okay, back to those wandering glands. How often do they actually stray from their usual location?
Well, the most common spot, about 80 to 85% of the time, is right where they're supposed to be,
Right,
tucked behind the thyroid gland.
right.
But in about 15 to 20% of cases, they venture off the beaten path.
And that's where this standardized nomenclature system comes in handy, right?
Exactly. It helps surgeons decode these anatomical variations and predict where those rogue glands might be hiding. It's like having a roadmap to the parathyroid gland's secret hideouts.
It makes you realize how much anatomical variation there is between individuals.
It really does. And it highlights the importance of individualized care, especially in surgery. No two necks are exactly alike.
So true. It's a good reminder that we're all unique, even on a cellular level. Well, we've covered a lot of ground today, from the surprising origins of sestamibi scintigraphy to the intricate details of parathyroid anatomy.
It's been a fascinating journey, hasn't it?
It really has. So before we move on, is there anything else you think is important for people to know about parathyroid surgery? What's the key takeaway you want to leave us with?
I think the most important thing to remember is that knowledge is power.
Right,
If you're facing parathyroid surgery, don't be afraid to ask questions and do your research.
right.
Understanding the different imaging techniques and surgical approaches can help you make informed decisions about your care.
That's such great advice. It's so important to be an active participant in your own health journey. And I think this deep dive has given us the tools to do just that. It's certainly been an eye-opener for me.
Speaking of eye-opening, did you know that parathyroid surgery has evolved dramatically over the years?
I was just reading about that in one of the articles you shared. It wasn't that long ago that a diagnosis of hyperparathyroidism meant a full-blown neck exploration.
It's true. Surgeons had to meticulously examine all four parathyroid glands,
Right.
which meant a much more invasive procedure.
It makes you shudder to think about it, doesn't it?
It does. But thankfully, things have changed for the better.
Yeah.
Advances in imaging and surgical techniques have led to minimally invasive procedures, which means smaller incisions, less pain, and faster recovery times for most patients.
It's a real testament to how medical innovation can improve people's lives. And speaking of innovation, I have to bring up intraoperative parathyroid hormone monitoring. That's a real game changer, isn't it?
Absolutely. It's like having a real-time feedback system during surgery.
Okay.
The surgeon removes the suspected adenoma
Right.
and then checks the patient's parathyroid hormone levels right there in the operating room.
So they get instant confirmation that they've removed the right gland.
Exactly. If the hormone levels drop significantly, it's a strong indication that they've got the right gland,
Okay.
and the patient is on their way to a cure.
That must be so reassuring for both the surgeon and the patient.
It is. It reduces the risk of missing any additional adenomas and helps ensure the best possible outcome for the patient. It's a perfect example of how technology and surgical skill can work together to improve patient care.
Now, before we wrap up, I have to ask, what's one thing about parathyroid glands that you think would surprise people?
That's a great question. I think many people would be surprised to learn just how tiny these glands are. We're talking about structures that are typically the size of a lentil
Wow.
or even a grain of rice.
Wow, that's incredibly small.
Yeah.
No wonder they could be so hard to find. It's like searching for a needle in a haystack, except the haystack is your neck.
Exactly. And yet these minuscule glands play such a vital role in regulating calcium levels throughout the body. It's a reminder that size isn't everything.
So true. Well, I think we've given our listener a pretty thorough deep dive into the world of parathyroid glands.
You've covered a lot of ground, from the basics of hyperparathyroidism to the complexities of preoperative localization and surgical techniques.
We've even touched upon the fascinating history and embryology of these tiny but mighty glands. It's been an enlightening journey.
It really has. And we've only just, scratched the surface.
I know, right?
Yeah.
It makes you want to keep digging deeper.
Definitely.
Well, on that note, I want to thank you for being our expert guide on this parathyroid adventure.
It's my pleasure.
You've really shed light on a topic that a lot of people, I think, probably don't even think about
Yeah,
until they're, facing surgery themselves.
it's true.
So, thank you.
You're welcome.
And to you, dear listener, thanks for joining us on this deep dive into the fascinating world of parathyroid glands. Remember, knowledge is power, especially when it comes to your health. So keep those curious minds engaged. And we'll see you next time for another deep dive into the world of science and medicine. Until then, stay curious and keep exploring.
It really has, and there's so much more.
I know there's always more to learn,
Yeah,
and that's why we do these deep dives, right?
exactly.
It's all about sparking that curiosity.
I love it.
So until next time, stay curious and keep exploring.